This patient was referred to me for endodontic treatment of tooth number 30. And this patient had pain. So as you can see, PFM crown on the tooth. And take a look here. Large, very large periapical lucency associated with the tooth, as you can see. And as I said, this patient was in pain. And on top of that, he's going out of the country. He's going to Europe in a few days. So we had to squeeze him in and do this root canal for him today. And that's what we did. Went through the PFM crown, 4 canal systems, 2 mesials, 2 distals. The mesial canals were like this. I'll show you. Were like this. 24 millimeter long working length, all 4 canals. Mesiobuccal, mesiolingual, distal buccal, and distal lingual, all 24 millimeters long. And take a look here. Look at this. See what I mean with the mesials? 2 mesial canals, 2 distal canals. Look at all of that anastomosis. Look, all of that anastomosis between the mesial canals. I did not use NiTi files in the mesial canals. The mesial canals were instrumented with stainless steel K files only. And every file I had to bend the apical 1 millimeter of the file, the 24 millimeter C files, number 8, number 10, number 15, I had to bend the apical 1 millimeter of the file just to be able to watch wind it to working length. So I would watch wind the files to working length, and then I would attach my M4 reciprocating handpiece while the file was seated to working length, and then I would activate the M4 reciprocating handpiece. And then once I activate the M4 reciprocating handpiece, the movement up and down movement was only half a millimeter up and down, and then I would increase it to a millimeter up and down, because if you just take the file out with the handpiece, then you would have to again bend the apical 1 millimeter of the file, watch wind it between your fingers to working length, and then reattach the M4 reciprocating handpiece to the file again. So this is how I instrumented the mesial canals. The distal canals were pretty straightforward, and I used 8 teeths E-Flex S NiTi files, rotary NiTi files. But the mesials, as I said, instrumented only with stainless steel K files, watch wound to working length, and then attach my M4 reciprocating handpiece to the file, and then half a millimeter up and down movements to instrument the mesials. And again, you can see all of this anastomosis and lateral right there. As you can see, everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist. I told the patient, please make sure you go see your dentist before you leave for Europe, because I don't want this temporary filling to come out while you're in Europe. Then now you have to find another dentist, a dentist in Europe. And then, of course, the temporary comes out. Now we're dealing with contamination. So we may have to to redo the root canal again. So I told the patient, you can, call your dentist, maybe even go there with a box of like a dozen donuts or something like that, so he can't say no to you, and get that temporary replaced with a permanent. I'd like to do these permanent fillings myself to build up myself, but most of my referring dentists, they want to do these themselves. They don't want me to do them, so that's why I temporize the teeth and refer the patient back to their dentist, because, as I said, most dentists want to do these restorations, permanent restorations themselves. They don't want their specialist, the endodontist, do them. But here it is.